In this video, we'll be examining the age-old question, does Satou from Welcome to the NHK have schizophrenia, schizoaffective disorder, or mood disorder with psychotic features? Welcome to the NHK is the anime equivalent of opening your window after 4 days of not seeing sunlight, uncomfortable, vaguely enlightening, and tinged with the smell of your own regret. At the center of it is his protagonist, Satou Tatsuhiro, a 22-year-old shut-in, convinced that a mysterious organization called NHK is behind his life falling apart. But what's actually going on with Satou? From a psychiatric perspective, is he psychotic, depressed, extremely online, perhaps all of the above? Today we're answering one question. If you were to diagnose him with the latest criteria from the DSM-5, would he meet the criteria for schizophrenia, major depressive disorder with psychotic features, or schizoaffective disorder? First, we should establish the symptoms that Satou as a patient presents with. First is his persistent delusions. In particular, he has a belief that NHK, the name of a Japanese broadcasting network, is a shadowy organization that is manipulating his life through media. This qualifies as a non-bizarre persecutory delusion. Next, he has social withdrawal. He's a hikikomori, but it's not just a lifestyle choice. It's rooted in a fear of the outside world and a sense of persecution. He also has marked depressive episodes in which he has loss of motivation, worthlessness, and suicidality. He satisfies more than 5 of the 9 Siggy CAPS criteria for a major depressive episode. In terms of his functioning in activities of daily life, they are markedly reduced and overall minimal. He's not working, not attending school, and barely maintains his hygienes. So we're looking at mood symptoms, psychotic features, and functional decline. The question is how they interact. First, let's go through schizophrenia. 2 or more of the following have to be satisfied for a month: delusions or disorganized behavior, and negative symptoms, with functional impairment and a continuous signs of disturbance for at least 6 months. However, in schizophrenia, mood symptoms are present for a minority of the total duration. With Satou, his depressive symptoms are prominent and sustained, not just background noise. If anything, his delusions flare up more intensely during mood episodes not independent of them. Next, we'll look at major depressive disorder with psychotic features. So, major depressive disorder with psychotic features is notable in that psychotic symptoms such as hallucinations or delusions are only present during depressive episodes. And so it might fit because he has both psychosis and depressive symptoms. However, his delusional beliefs persist outside of his depressive episodes. So his psychosis is not mood congruent, which rules out MDD with psychotic features. Finally, we'll look at schizoaffective disorder, depressive type. So this is actually a personality disorder and a subtype of that in the DSM-5, which has a major mood disorder with criterion A, symptoms of schizophrenia, and delusions or hallucinations for at least 2 weeks in the absence of a mood episode, and symptoms better not explained by major depression or schizophrenia. And so, because Satou has sustained mood episodes with psychotic symptoms, and importantly, there are periods where his delusions persist without obvious depressive symptoms, that would be the diagnostic pivot point. His psychosis has some degree of autonomy, but it's not strictly mood dependent, and the mood disorder is a major and ongoing part of his clinical picture. So, in conclusion, Satou has depressive type schizoaffective disorder.